I want to talk a little bit about mindfulness and what it is and what we know about it. So mindfulness is simply the practice of paying attention here and now with kindness and curiosity. So we can pay attention to our breath, we can pay attention to our thoughts, we can pay attention to our emotions, we can pay attention to sound, we can pay attention to our physical body, we can pay attention to the person who's in front of us, which gets back to the listening piece. And it's a skill that can be practiced. It's like a muscle, and it can get developed, so it can develop strength and flexibility and endurance if we use it routinely. What we know about mindfulness is that it decreases depression and anxiety and hostility by about 60% in adults. If we had a tablet for that, we would all take it. And there's actually a study published just this month showing that 8 weeks of mindfulness-based stress reduction in teens decreases depression and anxiety. This was a double-blinded, randomized controlled trial, so everything a scientist would want. They actually used the criteria that were shown before for depression, and clinicians who didn't know whether the person was in treatment or not reviewed the charts, and teens who were depressed and anxious by the specific diagnostic criteria that physicians require at the beginning of the study were not depressed and anxious at the end. So that's a pretty powerful response. And the beautiful thing about it is that anyone can do it. It can be practiced. It's being used in patients with chronic pain. It's getting a lot of press now for depression and anxiety. It's being used with soldiers for post-traumatic stress syndrome. It's being used with lawyers to facilitate mediation. It's being used with physicians to prevent burnout. It's being used with teachers to enhance their teaching and prevent burnout. And my particular area of interest is teaching to children, adolescents, and parents. I did my studies with 4th graders through 6th graders because they're old enough to fill out questionnaires. And I wanted to know how young we could start giving these skills to our kids. And my studies showed that by an objective measure, the children had enhanced capacity to pay attention, which is relevant to all our ADHD issues, and decreased anxiety. And in this particular study, the parents came too, and the parents had decreased anxiety, increased mindful awareness, increased self-compassion, which we're going to talk about in a minute, and increased parenting efficacy, which actually means they felt like they were listening, learning, and connecting with their kids more effectively.